I'm Mark Dawes here, and in this short video I want to talk to you about Seni's Law, which is a new law that's been proposed through Parliament at the moment. And the aim of this law, as you can see here from the BBC press release, is that this new legislation will require hospitals to publish data on how and when physical force is used. And the aim of this is to actually try and prevent any unnecessary deaths from people in mental health units from excessive use of force. Now, the proposal was launched by Steve Reid, who's an MP. He actually raised this in the Houses of Parliament on the 21st of July 2017. It's got a lot of support. I mean, Jeremy Corbyn is supporting it. And if we look at the British Institute of Human Rights here, they actually published a letter that went into the Times very recently this month. And it's been signed by a lot of people here. And they've urged all MPs to support this bill. And you can see even our good friend Eric Baskind is down there. He's actually signed to support this bill because the bill is designed to, the bill has been proposed, to push this new law through, because time and time again we're seeing people, particularly people from an ethnic minority, die in hospitals and mental health units because of what is now being described as excessive use of force. And in the case of Seni Lewis, he was restrained face down by 11 police officers in a mental health hospital. And they're saying again that this is not an isolated incident. You can read this here in the letter that went to the Times. It says evidence shows that face down restraint, which can be extremely dangerous, especially when applied for a prolonged period, was used over 12,000 times in mental health units in 2015 and 2016. And this is despite the Department of Health guidelines, which came out on the 1st of April 2014, which actually says that the prone face down restraint should not be used. That's the positive and proactive care document. And here we can see on the inquest webpage, they've issued a press release on this, talking about Seni's Law. They're talking about the bill, which would include, so if this bill is enacted, it will include increased oversight and management of use of force in mental health units, improved regulation to reduce levels of force used, improved arrangements between police and mental health units, including requiring police to wear body cameras when attending these units, and a requirement that an independent investigation follows deaths rather than internal investigations by health trusts, as is already the case in prisons and police custody. And inquests have apparently called for this since 2015. They also report here that the jury in this case unanimously condemned the actions of police and healthcare staff who watched on as Seni was restrained by 11 police officers. The inquest found that force was excessive, disproportionate, and contributed to Seni's death. So, inquests have been lobbying on this for a while now. They've also here, they go back to the death of Rocky Bennett, who died in 1998, where there was a public inquiry, and they called for, here you can see, accredited training for staff in restraint and an escalation. I'm presuming that means de-escalation. But, they're saying now, 19 years on, nothing much has happened. So there's a lot's going to happen with this, and you've seen already it's been supported by a lot of people. There's, in the letter to the Times that went out here, all of these people under here are actually supporting this bill, including our good friend Eric. The politicians are behind it. An MP has actually proposed this. The BBC are all over this, and I actually think this is a good thing. There should be robust processes and transparency, and the elimination of techniques, or at least the reduction in the use of techniques that increase the risk of death. And that's a requirement under Article 2 of the Human Rights Act anyway. When we interviewed Michael Mansfield on this years ago, he said any organisation that is using techniques that are known to increase the risk of death without looking at alternatives and trying to find the evidence for other ways of doing this stuff are highly, highly culpable should a death occur. Now, one of the things, I'm delighted about as an organisation is we work with lots of organisations, and we've managed to reduce, virtually eliminate the need for prone and face down restraint, not just by technique, but by the introduction of safer methods and safer equipment. And if any of you are interested in knowing more about that, put a comment underneath, drop me an email. I'll be delighted to talk to you. But this is, going to be a big thing. If this law is passed, which it will be, it's going to be huge, and it's going to have implications for all mental health units and all training providers. And I think this aspect of accredited training should be something that should be looked at properly, and the accreditation should be looked at properly to make sure that if someone is saying they are accredited, there is an accreditation process recognised by a recognised accrediting organisation, not just some self-accredited thing. But anyway, that's enough on that for now. I just wanted to get this out there for you so you can see what's happening. Like I said, any comments, Any questions, please leave a comment below. Please share this video out there. This is going to impact our industry in a huge way. So we need to prepare for this if you haven't already done so. Thanks ever so much for listening, and I'll speak to you soon.